lot of illness kind of in the early November, early December timeframe. So we are definitely implementing later this year. That's to reflect when we're seeing that increase in cases that necessitates these extra measures.
Okay, great. And then Alicia, if you want to go ahead, she's kind of recording this, Dr. Passaretti, so she's going to do a couple, just like a Q&A with you.
Uh-huh.
So if you want to go ahead, we can't hear you yet. If you want to turn your mic on.
Okay, can you hear me now?
Yep, we got you.
Perfect. And I just want to also make sure that I'm saying her name correctly. Passaretti.
You got it.
Dr. Passaretti. Okay, sounds good. I'm just going to lead into something. Thanks so much for doing this. I'm just going to talk for about 20 seconds and bring you in if that's okay.
Go for it.
Okay, sounds good. Let me just bring this back really quickly and then let me know behind the scenes when we're ready to record. Well, new visiting restrictions go into effect at Novant and Atrium as respiratory viruses spread. So starting Tuesday, children under the age of 12 are asked not to visit Atrium Health facilities, and children under the age of 13 are asked not to visit Novant Health hospitals in North Carolina unless they're getting treatment. So this is an effort to be able to take extra precautions to reduce the spread of respiratory viruses. And joining us now to talk about this change, Atrium Health internal medicine and infectious disease Dr. Katie Passaretti. And Dr. Passaretti, tell me first, I mean, you see just the worst of these viruses being an infectious disease, doctor. So for this change to happen, what are you seeing that you can let us know as to what's going on behind the scenes?
Yeah, so both within our hospitals in this area as well as in our communities, we're seeing pretty steep increases in specifically flu and RSV. Those patients, maybe some of them end up in the hospital, and that's adding to already high patients in the hospital setting in our emergency department. So, it certainly is hitting our communities and causing significant impact.
So at Atrium Health, are the temporary visitor restrictions in all areas of the hospitals? And how long do you think these restrictions will actually be in place?
Yeah, so our goal with these additional measures are really to protect our patients when they're at their most susceptible. So in our acute care hospitals where patients are admitted, they have lots of healthcare worker contact, they're sicker and at higher risk if they do get a virus. In our congregate settings, so areas where a lot of patients and a lot of teammates and sometimes visitors all mix and mingle, so skilled nursing facilities, rehab centers, and then in our clinic areas, specifically the ones that are highest risk, so have our bone marrow transplant patients and whatnot. So not every area in the Atrium footprint has these restrictions. It's really